So hello, I'm Dr. Jonathan Leach. I'm a GP here in Worcestershire and I'm Joint Honorary Secretary of the Royal College of GPs. I'm joined by Professor Martin Marshall, Chair of the Royal College of GPs, and we're going to be particularly looking at the issues around personal protective equipment on this vlog. So Martin, what are you hearing?
So Jonathan, good to speak to you. It's good to have another opportunity to talk about PPE, which remains one of the top issues for GPs. We're hearing a lot about it, both on our COVID email, but also through the members forum as well. We're hearing probably less about the availability of PPE than we did a week ago when we last did our blog on this subject. And we're hearing more both about the need for clear guidance about what PPE people should be using, but also about when to use it as well.
And how has the college responded to these concerns, Martin?
Well, we're feeding those concerns directly into our contacts in all four nations, into ministers, into our civil service contacts, and also, in my case, into NHS England. And they're hearing loud and clear, we're persistent and we're vocal on behalf of general practitioners about how important this is, not just to GPs actually, but to staff groups across the NHS. In community and in hospital settings. Ambulance and care homes, for example, are very relevant to us. We sent a letter to the Secretary of State in Westminster last week. He's responded very positively to that, and there's been an awful lot of media coverage. You and I and other officers have done a fair amount of media work over the last few days to make sure that the message is heard loud and clear. We've made a very strong case, which we know needs to be guided by evidence. Of course, that's what we're here for as a college. But we've also made a strong case that we need to understand the concerns and the anxieties that are being expressed by frontline staff, and that the perceptions of being safe are just as important as the evidence in this area.
Yes, I would agree with that. And what has been the response from those that we've been talking to?
Well, the response has been very positive in terms of sorting out the logistics. NHS England now tell us that all practices across England have got PPE in place, and we're hearing similar things in Wales, Scotland and Northern Ireland. Of course, that might not be true. This is what we're being informed. Might not be true, and if it isn't true, it's really important that practices let us know through the COVID email so that we can follow up if that's necessary. As a result of the intervention that we made, NHS England have agreed to update their guidance for PPE in community settings. That's going on right now, and we've been inputting into that process. And the advice is now, very much in line with what we've been asking for, that standard PPE should be used for just about all face-to-face consultations that take place in general practice. That's on the assumption that we aren't between those who might not be positive for COVID. Of course, there has to be some space for professional judgment. If you're seeing a young child who's frightened by seeing you in a mask, you might decide to take it off. Professional judgment is important. We're hoping that this guidance will give reassurance that clinicians are able to deliver the kind of care that they want to deliver at minimal personal risk to themselves and to their staff.
Yes, and of course that's very important, you know, for all of us who are seeing patients. So what do you mean by standard PPE?
Well, standard PPE in our setting, in a relatively low risk setting, is about a standard mask, an apron and gloves. Those are the standard three pieces of equipment. And in addition, eye cover, eye protection. Some people are getting it from the local DIY shop or just using their glasses if you think somebody might be coughing and spluttering. So that's the standard equipment. There, of course, is an upgrade to equipment which is available for people working in high-risk settings, particularly people who are exposed to aerosol, like dentists and like anaesthetists. That equipment is in limited supply, of course, and we think it's right that it's prioritised to those who are at greatest risk. There is a question about what we mean by aerosol, of course. So something like a nebulizer, is that an aerosol? We think it probably is. Seeking guidance on that, I know colleagues Northern Ireland have said you shouldn't be nebulizing in general practice because it is a risk. We're seeking guidance on that in order to understand what is required. But overall, that standard level of PPE seems to be adequate. We commissioned Chris Greenhow from Oxford to undertake a review of the evidence. That evidence is available on our website, a link to the Oxford Centre, and that seems to uphold the position that we've taken at the moment.
Yes, and that's a very good review, isn't it? It's an independent review of the work done by Public Health England and other devolved nation public health departments. And I think having that probably will give a lot of assurance to people about things. But as you say, there are lots of questions. And again, we've been asking those. One of the things that we have posed to us is around reception staff. Obviously, these are key members of our colleagues and obviously sometimes our employees. So what about reception staff?
So the guidance which is about to come out says that reception staff, by and large, particularly as long as they can maintain the acceptable safe distance of 2 meters from patients, don't need to have any protection. I do know that some practices are supplying their staff with face masks. If they're able to do that, I think that's probably fine. It probably isn't absolutely necessary.
And do you think this overall level of protection is sufficient? Obviously, because receptionists can be there, actually at a desk if you've got somebody coming in, although clearly, obviously, we're, advising practices very much to do remote and video consultations first.
Yeah, that's right. I mean, I think all practices will recognise that the number of face-to-face consultations has dropped dramatically. I don't know what the actual percentage is. I'd be surprised if it's much more than 10% of patients, probably less than that, that are being seen face-to-face now. About whether this level of protection will reassure people, whether I'll be able to talk to my team within my own practice in East London and say, look, we're confident this is okay. That's a really big question. I think we can say with some confidence, it looks to be fine now. We know that the evidence is changing all the time. We want to collect data along the way. When things change, we will let people know about it.
Yes, I think that's very fair. And of course, as we said at the beginning, we as the Royal College have been, looking at the evidence ourselves. And of course, we have been, literally lobbying behind the scenes and in public regarding this. We absolutely appreciate that this is a concern for us as individuals because of the fact that we're clinical doctors ourselves. And also, obviously, on behalf of the college. Are there any other final points that you want to cover, Martin?
No, I think we really want feedback, so please do keep on feeding back through email or join the Members Forum. The Members Forum is really off in a big way. It's run by Amanda Howe, our president. There are over 2,500 participants in the forum at the moment, posting their concerns, sharing good practice, sharing their problems. That seems to be going really well. So please keep on feeding back to us. And we will do future blogs, maybe even another one about this subject area, but certainly about other subject areas that are coming up. I think there's likely to be one on access to technology fairly soon, because that seems to be a big issue to allow GPs and their staff to do remote consultations.
So thank you very much, Martin. I hope everybody finds this helpful. Thank you very much.